3 in 100 Filipino women will develop breast cancer by the age of 65. Studies show the Philippines has the highest incidence of breast cancer in Asia. But knowledge and early detection can help change this. To commemorate Breast Cancer Awareness Month, on today's program, we'll take a closer look at how women can be proactive with their breast health. I'm Dr. Freddy Gomez. This is Medtalk Health Talk, your connection to healthcare. Globally, the survival rate of breast cancer among women has seen a steady increase. And this has been attributed to early detection. Women are becoming more mindful and knowledgeable of the signs, symptoms, and preventive measures. Our guests are here to help further inspire this cause. With us is Dr. Aldin Basa from the Asian Hospital and Medical Center. We're also joined by Ms. Bibeth Orteza. She's a spokesperson of the I Can Serve Foundation. There's still a lot to learn about breast cancer. In fact, most women don't know what caused their cancer. But there are factors that could increase the likelihood of developing it. Dr. Basa, can you share with us some of those risk factors?
So there are many risk factors that increase your risk of getting breast cancer. The single most important risk is age. As we age, our risk increases. If you've had breast cancer before, the chance of getting it again is higher, or if you've had ovarian cancer or uterine cancer before. We also know that about 60% of breast cancers are stimulated by estrogen, the hormone within us. So if you have your menstruation before 12 years old or menopause after 55 years old, this increases your risk because you've been menstruating for a long time. And so your exposure to estrogen is longer. If you've never been pregnant, or never breastfed, or had your first pregnancy after 30 years old, these are also risk factors. If you've taken hormone replacement therapy or the oral contraceptive pill for prolonged periods of time, this is also a risk factor because you're adding estrogen to your body. But remember, only 10% of breast cancers are hereditary. So 90% are not. So if you have a relative, a first-degree relative with breast cancer, it will increase your risk. But that doesn't mean that definitely you will get it. If you're obese or overweight, this will also increase your risk because the fat contains the precursor for estrogen, which is estrone. So meaning your estrogen levels are higher. So this is why this is an increase. This is a risk factor. And also high alcohol intake has been associated with an increased risk for breast cancer.
There are also some risk factors that we have control over or that are modifiable. What do these include? I think you mentioned some a little earlier already.
So what is within our control is obviously we can control our weight. You can eat a balanced diet, exercise. If you have to take oral contraceptive pills or hormone replacement, take it intermittently, not for prolonged periods of time. And also for alcohol, you can decrease your alcohol intake. But all the other risk factors are beyond our control.
And we want to emphasize that these risk factors don't necessarily mean you'll develop breast cancer. So it's always a good idea to have a healthy dialogue with your doctor regarding these. Now let's talk about the signs and symptoms. Ms. Bibeth, while these can vary widely, what are some of the common symptoms?
I didn't have symptoms when I was diagnosed with breast cancer in 2004. Then I quit smoking in August of that year, gained a little weight. Then I went into boxing to lose weight. I think what happened to me was my body got sort of relatively healthy. So I started to realize that things were not right with me. I had no lumps, but my right breast started to move like it had a mind of its own. When I would go on the bed, to go to my left side, the right breast would move so slow, so heavy. It was out of sync with the rest of me. They saw the shadow of an involvement on my right maxilla.
What the viewer should get from this is that hindi po pare-pareho ang simptomas ng breast cancer. Nagkakaiba siya from person to person.
Yeah, okay. That was very clear. What happened was when finally, because of what I was saying, They couldn't see anything in my blood tests, no elevated tumor markers, nothing. What they found out was I did have a lump, and it was huge. It was over 3.5 cm, attached to my rib cage. They had to manipulate it to make it surface, and that's how they realized that, yes, I could have something.
Okay, so we'll talk further about your journey about that a little while later. But we want to remind our audience again, the presence of one or more of these symptoms don't necessarily mean you have breast cancer. But if you're experiencing any of these symptoms, don't wait too long. Please consult your doctor. When we return, we'll talk about early detection, the cornerstone of breast cancer control. You're watching Medtalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez. You're watching Medtalk Health Talk on CNN Philippines. Earlier, we talked about the risk factors of breast cancer. And some of these risk factors, like family history, can't be controlled. But there are proactive measures that can be taken to lower your risk. Dr. Basa, before we talk about these measures, can you explain to us the different types of breast cancer?
Okay, so there are two main types of breast cancer, the most common being your invasive ductal carcinoma. The other type is an invasive lobular carcinoma, which has a predisposition to appear in both breasts. And the others are more rare types, but those are the two main types. And then the very earliest form of it is the non-invasive type of breast cancer, what we call your ductal carcinoma in situ, which is a pre-cancer. So that's what we call stage 0.
And one of the proactive measures that can be taken is the breast self-exam. 40% of diagnosed breast cancers are detected by women who feel a lump. Dr. Basa, how should a breast self-exam be performed and how often should this be done?
Okay, so actually all women should be doing self-breast exam once a month, starting at 20 years old. And we should do this about 7 to 10 days from the first day of menstruation. If you are already menopause, then do it on the first day of every month. Pick a day in the month where you do it. And usually you do it using your 3 middle fingers, palpate the left breast with your right hand and the right breast with your left hand. And when you palpate, do it in a circular motion, covering the entire breast and really palpating deeply so that you can feel for any changes, feel a lump, feel something that wasn't there before. It's very hard to teach what's a lump what a lump that's cancerous feels like and what a benign lump feels like. So what we really tell people is that you have to feel for a change. So it's important that you examine your breasts every month so that you know how it feels, what normal feels like. And then if there's a change that happens, you're able to detect it and see a doctor.
Now, Ms. Bibeth, is the self-test enough? Why do women need mammograms or breast ultrasounds for that matter?
No, because you have to confirm what you think you felt in your self-examination. It's not enough for you to say, oh, I may nakapa akong bukol, oy, may maliit na bukol, and then manonood na lang ako ng sine, mag-Netflix na lang ako, not do anything about it. You still have to have it confirmed scientifically that there is something, because there are steps and procedures to follow. You need to go see a doctor right away.
What can patients expect when they go for a mammogram?
So the mammogram is very important because this test is the only way that we can detect breast cancer early. And it is the only thing that has been shown to decrease the death rate from breast cancer by 20 to 30% because we're able to catch it early. So it's really it's like an x-ray of the breast. So the breast is squeezed between two plates in two views. So it's squeezed horizontally and vertically. So we can see the two views of the breast and look in at the image. And mainly the first thing that we actually look for there are calcifications, which are calcium deposits in the breast. And there are certain configurations of this that give you the very first sign of cancer. So it can actually detect it when it is still pre-malignant or non-invasive, or what you call the stage 0. That's why it's able to pick up cancer very early.
Now, one of the bigger risk factors is your family history. But as Dr. Basa said a while ago, it's roughly around 10%. Because women with close relatives who have been diagnosed with breast cancer are at higher risk. And knowing your family history can make a big difference in early detection. Now, Ms. Bibeth, can you tell us more about this?
There are genetic factors to consider. I was the first breast cancer patient in our family. My mother didn't have it, my sister didn't have it. But I had all the other factors there ready.
Okay, understandable. Now, I want to go to Dr. Basa because I'd like to talk about the treatments needed for breast cancer. Dr. Basa, what are the treatment options available here in the Philippines? And a good question is, when is surgery needed?
First of all, for once you get diagnosed with breast cancer, definitely you need surgery. Surgery is the main treatment. So once you get diagnosed, you have the biopsy, you go for surgery. With surgery, you have two options. We can either remove the breast entirely or preserve the breast. If we remove the breast, we also have the option of reconstructing it immediately. So after we remove it, we can put in an implant to reconstruct, or we can get your own tissue, like for example, your abdominal tissue, your bilbil, and make a new breast at the same sitting. So the first part is surgery. After surgery, the breast that we have removed or the tumor is examined, and then we have tests done on it to find out if it is aggressive or not. And based on all those tests, we determine whether you need chemotherapy afterwards, or radiotherapy or hormonal therapy. So there's additional treatment afterwards. But it doesn't mean that if you have breast cancer, you need everything. Most cases, you just need surgery and maybe a tablet. So it's quite a long treatment if you don't get diagnosed early.
So very important to have a good dialogue with your doctor and know your body. Listen to the signs that your body is telling you. With that, I'd like to thank you, Dr. Aldin Basa and Ms. Bibeth Orteza, for sharing your insights on this very important topic. When we return, we'll talk about life after breast cancer treatment. Keep it right here on Medtalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez. We want to be your partner for a lifetime of good health. October is Breast Cancer Awareness Month, and in light of our current situation, it's even more vital that we give breast cancer patients the care they need. We need to make sure they feel empowered in all stages of their treatment. Joining us is Dr. Buenaventura Ramos Jr. He's the president of the Philippine Society of Medical Oncology. It's good to have you on the show, Dr. Bill.
Hi, Dr. Freddy. Thank you for having me.
Now, the World Health Organization's findings have ruled out that patients with cancer have a higher risk of COVID-19 infection. But these patients do need greater support and awareness amid the pandemic. Dr. Bill, what are the ways breast cancer patients can reduce the risk of contracting COVID-19?
Still, COVID-19 continues to have serious impact on many people, including cancer patients. And some cancer patients may be at risk. As I have said, not all, but some patients are at risk of serious illness from an infection due to a weakened immune system brought about by cancer itself or by cancer treatment like chemotherapy or radiation therapy. Most people who were treated with cancer in the past, however, especially if it was years ago, are likely to have normal immune function already, although each person is different. Most international cancer societies and our very own, the Philippine Society of Medical Oncology, have released guidelines for doctors on cancer management during COVID-19. And most doctors are actually following these guidelines. So the pandemic is also affecting the way the people are getting medical care. So it's important to keep in contact with your doctor to determine the best course of action for you, which may involve sometimes telemedicine or online consultation, which most doctors offer nowadays. Telemedicine is the use of remote health care which makes it possible for doctors to treat patients whenever needed and wherever the patient is by using a smartphone or a computer.
Now, it's good these guidelines are already out. And how can these patients keep safe, though, when administering treatment in hospitals or even just going for regular checkups?
In our hospitals and in our clinics, we established health protocols and safety protocols. We still continue doing the contact tracing by filling out health declaration forms. We did some revisions on our cancer treatment centers and including our clinics. So we schedule our patients, we monitor the number of patients coming in, we do all those things. And of course, the general recommendations of hand washing, wearing masks, and physical distancing, among others. While cancer therapy can sometimes be delayed safely or modified, some patients are actually still needed to be given chemotherapy, which can actually lower the immune system, and weaken their immune system because of lowered blood counts. So when patients are given chemotherapy, we make sure that they are also given these supportive treatments to stabilize their blood levels so as not to lower their immune system.
And the support doesn't stop once they finish their treatment. Breast cancer survivors need to feel empowered even after treatment, especially given the side effects that come with it. Now, Dr. Bill, how can these survivors best cope with side effects like fatigue or what they call chemo brain?
We have always encouraged our cancer patients to join cancer support groups where they have lots of wellness activities. Aside from having a lot of listening ears as they share their anxieties and worries related to the pandemic, their cancer journey or life in general, we have supported the activities of these cancer support groups. And sometimes we join them. They have virtual Zumbas, they have virtual yoga, healthy cooking and healthy eating, and of course, the ever popular gardening sessions with the plantitos and the plantitas. All these things are actually mindfulness activities where they can focus on the present moment. And these activities are proven to enhance their memories. That would help with the chemo brain and all the anxieties that is brought about by the pandemic, aside from the anxieties brought about by their treatment and their cancer. Focus your mind, body, and spirit on whatever you're doing, then you'll become grateful and you become appreciative of your present moment experiences. That would be enough.
Now let's focus on those who are living with breast cancer survivors. How can loved ones provide supportive care throughout the recovery process?
The first support of cancer patients are actually not from cancer support groups or fellow survivors, usually from the families. So what we recommend is for these patients to be open with their emotions. Once they're open, then their family members can also be open. Once they have openness with each other, then we would limit their isolation. Otherwise, if they're not open, they tend to isolate from each other. So openness is what we recommend. Openness with your emotions, openness with how you're feeling right now, your anxieties. Be open, and then you'll be together solving those anxieties and stresses of daily living, aside from the stresses of the cancer journey.
And if you're a breast cancer patient, wherever you are in your journey, know that there's support and care for you. Before I let you go, Dr. Bill, do you have a message for our viewers?
Because of COVID-19, people have actually become afraid to visit their doctors or go to the hospital. But we remind them, especially for cancer, when survival depends largely on early detection and timely treatment, that safety and health protocols are in place in the hospitals and in our clinics. We control the number of people coming in. We have triage officers. We observe physical distancing. We fill out health declaration forms. For effective contact tracing, we wear full PPE. We separate the COVID and the non-COVID areas. And researchers have shown that not all cancer patients are actually COVID-19 vulnerable. Your doctor would evaluate your risk, then subsequently do some changes if really needed. So please get in touch with your doctors because cancer doesn't sleep during a pandemic. Don't wait for everything to be back to how it used to be because it may not. That's why we have the new normal. We doctors will proceed with care, compassion, and with caution. So don't wait because cancer doesn't wait. Thank you.
We'd like to thank our guest for today, oncologist Dr. Buenaventura Ramos Jr. I'm Dr. Freddy Gomez. On Medtalk Health Talk, we bring you the knowledge and care you need, especially in this time of COVID-19. We'll see you again next time. Stay safe and be well.
This program is brought to you by